Hello everyone, welcome to my channel. Today I am going to explain about hospital and its organization. So first we have to know about the definition of a hospital. A hospital is an important unit of a society which helps the sick and injured people to attain their health. So it provides treatment to the sick and injured people, and the hospital tries to cure the sick and injured people. It provides patient care services like prevention, diagnosis and treatment of diseases with the help of group of healthcare professionals like physicians, surgeons, nurses, physiotherapists, pharmacists, etc. According to Pasteur, a hospital has to cure sometimes. Since not all diseases can be cured, there are diseases that cannot be cured. The hospital has to cure sometimes and it has to alleviate often. That is, we have to reduce the disease condition. Worsening of the disease condition should be reduced. We have to reduce the symptoms. So we have to alleviate often and comfort the people always. Since every patient is given symptomatic relief, every patient is treated by symptomatic conditions, a hospital has to comfort the people always. Then coming to clinic. What is a clinic? It is an institution which provides health care to the outpatients, that is nothing but ambulatory patients. It is run by several specialists working in cooperation and sharing same facilities. Then let's talk about the classification of hospitals. Hospitals are broadly divided into two types, based on level of service and based on clinical and non-clinical basis. So based on level of service, hospitals are further divided into primary, secondary and tertiary. Based on clinical basis, hospitals are further subdivided into four types: anatomical and physiological specialization, based on type of diseases cured, based on group of people served, based on system of medicine followed. On non-clinical basis, hospitals can be further divided into two types, based on the type of ownership and based on hospital size. So classification of hospitals based on level of service. Depending upon the level of service, hospitals may be classified as follows. The first type is primary hospitals. Primary hospitals are the first level of contact between individuals and families with the health system. So whenever a patient comes across symptoms, he or she will be approaching the primary hospital first. It usually consists of a general physician or a family physician. The primary care hospital's purpose is to serve the community, which include care for mother and child, family planning services like tubectomy and vasectomy are conducted at the primary hospitals. Immunization services like provision of vaccines to the children as well as adults are provided by the primary hospitals. Prevention of locally endemic diseases, prevalent diseases which are spreading quickly, those should be treated and prevented by the primary hospitals. Treatment of common diseases like that of common cold, fevers, diabetes, hypertension, they are taken care by the primary hospitals. Treatment of injuries in case of falls or in case of road traffic accidents, so they should be taken care by the primary hospital. Provision of essential facilities and health education. So providing health awareness among the patients, this is the responsibility of primary hospital. The primary hospital contains beds up to 30 to 50. So the bed capacity of a primary hospital is 30 to 50. So manpower in primary hospitals as per IPHS staff pattern. IPHS is Indian Public Health Services. So the personnel required are, first one is block health officer. The strength of block health officer varies according to the hospital. The qualification required is senior most specialists among below mentioned specialities. So it requires one general surgeon who has a qualification of MS, Masters in Surgery, or DNB, Diploma in National Board General Surgery. It requires a physician, one physician with a qualification of MD, Doctor of Medicine, or DNB, General Medicine. It also requires obstetrician and gynecologist with a qualification of MS or DNB or DGO. DGO is Diploma in Gynecology and Obstetrics. One pediatrician is required with a qualification of MD in Pediatrics or DNB or DCH. DCH is Diploma in Child Health. One anesthetist is required with qualification of MD in Anesthesia or DNB or DA. DA is Diploma in Anesthesiology, which is a certificate course in anesthesia for 1 year. It also requires one public health manager with MD in PSM. PSM is Preventive and Social Medicine, or MD in CHA. CHA is Community Health Assistant, or MD Community Medicine, or PG with MBA. One eye surgeon for every 5 CHCS, Community Healthcare Services. So qualification is MD or MS or DOMS. DOMS is Diploma in Ophthalmology and Medicine and Surgery, or DNB Ophthalmology. Then one dental surgeon is required with a qualification of BDS. BDS is Bachelor of Dental Surgery. Then one general duty officer. The strength required is 6. Among 6, at least 2 females are required. So qualification is MBBS, Bachelor of Medicine and Bachelor of Surgery. One specialist of Ayush. Ayush is Ayurveda, Unani, Yoga, Siddha and Homeopathy. So qualification is PG in Ayush, and one medical officer of Ayush who is a graduate in Ayush. Coming to secondary hospitals. Secondary hospital refers to a second tier of health system in which patients from primary health care are referred to specialists in higher hospitals for treatment. Since primary hospitals do not have a comprehensive diagnostic system and comprehensive healthcare specialists, patients from primary hospitals are referred to the secondary hospitals whenever required. It provides healthcare services through registered medical practitioner under the supervision of specialists. Other support systems required for these services include pharmacy, laboratory, diagnostic facilities, etc. Secondary level of healthcare functions to provide curative, preventive and promotive healthcare service in the district. So every district is expected to have a district hospital linked with public hospitals or health centers. The districts such as sub-district or subdivisional hospitals, community health centers, primary healthcare centers and sub-centers. So at present there are 604 district hospitals in 640 districts of the country as per NRHM data, National Rural Health Mission data as on 30/6/2010. So this is the manpower required in secondary hospitals. Specialty medicine, 100-bedded hospital requires 2, 200-bedded hospital requires 2, 300-bedded hospital requires 3, 400, 4, 500 and 5. So surgery department, 100 bedded hospital requires 2, 200 requires 2, 300 requires 3, 400 requires 3, 500 requires 4. Obstetrics and gynecology. 100 bedded hospital requires 2, 200 requires 3, 300 4, 400 5 and 500 6. Coming to pediatrics department, 100 bedded hospital requires 2. 200 bedded hospital requires 3, 300 bedded requires 4, 400 bedded requires 4, 500 bedded requires 5. Anesthesia department, 100 bedded hospital requires 2, 200 bedded hospital requires 2, 300 3, 400 3, 500 4. Ophthalmology, 100 bedded hospital requires 1, 200 1, 300 2, 400 2, 500 2. Then orthopedics department, 100 bedded hospital requires 1 orthopedician, 200 requires 1, 300 requires 2, 400 2, 500 2. Coming to radiology department, 100 bedded hospital requires 1 radiologist, 200 1, 300 2, 400 2, 500 2. Coming to pathology department, 100 bedded hospital requires 1, 200 requires 2, 300 3, 400 3, 500 4. Then ENT specialist, ear, nose and throat specialist. 100 bedded hospital requires 1, 200 1, 300 2, 400 2, 500 2. Then dental services, 100 bedded hospital requires 1, 200 1, 300 2, 400 3, 500 3. MO is medical officers. So 11 medical officers are required in 100 bedded hospital, 13 in 200 bedded hospital, 15 in 500 bedded hospital, 300 bedded hospital, 19 in 400 bedded hospital, 23 in 500 bedded hospital. Then coming to dermatology, 1 dermatologist is required for 100 bedded hospital, 200, 300, 400 and 500. So all the 100, 200, 300, 400, 500 bedded hospitals will require 1 dermatologist, 1 psychiatrist, 1 microbiologist and 1 forensic specialist. Then Ayush doctors, 1 Ayush doctor is required for 100 bedded hospital, 1 for 200, 1 for 300, 2 for 400, 2 for 500. So if we total the manpower for 100 bedded hospital, we require 29 plus 3 individuals. Then 200 bedded hospital, we require 34 plus 3 doctors. 300 bedded hospital requires 50 doctors. 400 bedded hospital requires 58 doctors. 500 bedded hospital requires 68 doctors. Here, if more than 1 Ayush doctors are available, at least 1 doctor should have a recognized PG qualification in relevant system under Ayush. Then coming to the third type of hospitals, that is tertiary hospitals. Tertiary care hospital refers to a third level of health system in which specialized consultative care is provided on referral from primary and secondary medical care. So the diseases which are not diagnosed in the primary and secondary hospitals, which cannot be treated in the primary and secondary hospitals, they are referred to the tertiary hospitals. Specialized intensive care units, advanced diagnostic support services and specialized medical personnel are the key features of tertiary hospitals. So tertiary hospitals have specialized ICUs, NICU, MICU, all these specialized intensive care units are provided in the tertiary hospitals. In India, under public health system, tertiary hospitals are provided by medical colleges and advanced medical research institutes. It shall include the requirements of Medical Council of India or other registering body. So examples of tertiary hospitals found in India are Osmania Medical College, Hyderabad, All India Institute of Medical Service, All India Institute of Medical Sciences, located at New Delhi, also located in Amaravati, Mangalgiri, Vijayawada. The primary function of these hospitals is to provide complex clinical care to patients referred from lower levels. So any complex case which cannot be identified in the primary and tertiary level will be sent to the tertiary, secondary level. Primary and secondary level, if they cannot identify the complex case and they cannot cure it, they will be sending it to tertiary level. However, no agreed international guidelines exist of which specific services are to be provided in secondary or tertiary hospitals in developing countries. So we do not have an international guidelines regarding the services that are to be provided in the secondary and tertiary hospitals. The exact range of services offered tends to vary substantially. So let us know the difference between primary, secondary and tertiary level hospitals. So primary level hospital, there are few specialities, mainly internal medicine, obstetrics and gynecology, pediatrics and general surgery, or just general practice, that is general medicine. So we have very few specialities in primary level hospital, and the laboratory services are also limited, and they are for general but not specialized pathological services. The general testing can be done, but specialized pathological services are not provided by the primary level hospitals. So the alternate names for primary level hospital is primary health care, or sub-district hospital, or rural hospital, or community hospital, or general hospital. Coming to secondary level hospital, it is highly differentiated by function with 5 to 10 clinical specialities. So there are many clinical specialities available in secondary level hospitals. Unlike the primary level hospital, they have 5 to 10 clinical specialities. Many departments are available. Size ranges from 200 to 800 beds. The bed capacity of primary level hospital is only 30 to 50, but here in secondary level hospital, the bed capacity is 200 to 800 beds. So often the hospitals at secondary level are referred to as district hospitals. So alternate names are district hospital, or general hospital, or regional hospital. Then coming to tertiary level hospital, highly specialized staff and technical equipment, for example cardiology, intensive care units and specialized imaging units. Like specialized imaging units like MRI scan, CT scan, etc. can be performed at tertiary level hospital. Clinical services highly differentiated by function. So we can see a lot of departments with a lot of specializations in the tertiary level hospitals. Could have teaching activities. So tertiary level hospital provides teaching activities to the medical interns, pharmacy interns and the hospital staff. Size ranges from 300 to 1500 beds. So bed capacity is 300 to 1500 beds. Alternate names for tertiary level hospital are National Hospital, academic or teaching hospital. So second type of classification is based on clinical and non-clinical basis. Depending upon clinical and non-clinical basis, hospitals can be classified as follows. On non-clinical basis, hospitals are further divided as follows. So first type is based on anatomical and physiological specialization. So based on the organs or system that they are treating. That examples are cardiac hospital, ENT hospital, ear, nose and throat hospital, eye hospital, hospital for gastrointestinal diseases, kidney hospital, orthopedic hospital. So based on the anatomical and physiological classification, they are dividing the hospital. Then second type is based on type of diseases cured, based on the type of disease that the hospital is curing. So examples are cancer hospital, which treats cancer, hospital for communicable diseases, that is infectious diseases which can be spread easily, hospital for neurological and mental disorders, hospital for sexual diseases, hospital for skin diseases. Then third type of classification is based on group of people served. So based on the type of people that they are treating. So examples are hospital for children, pediatric hospital, hospital for elderly people, that is geriatric hospital, hospital for pregnant women, which is maternity hospital, hospital for women, gynecological hospital, and hospital for drug addicts. Then the fourth type is based on the system of medicine followed. So some of the hospitals will be following allopathic system. So those hospitals are called allopathic hospitals. In these hospitals, allopathic system of medicine is followed, nothing but English medicine. Then Ayurvedic hospitals. In these hospitals, Ayurvedic system of medicine is followed, where diseases are treated using herbs. Then homeopathic hospitals. In these hospitals, the medicine used is notable for its practice of prescribing water-based solutions that do not contain chemically active ingredients. Then Unani hospitals. In these hospitals, the Unani system of medicine is followed, which comprises of drugs obtained from animal, vegetable and mineral sources. Then the fifth type is Siddha hospitals. In these hospitals, the Siddha system of medicine, which is a branch of Ayurveda, is followed, which has originated from the southern parts of India. Then we have seen about the clinical basis of classification of hospitals. Next we will see about non-clinical basis of classification of hospitals. On the non-clinical basis, hospitals are further divided as follows, based on the type of ownership. So based on type of ownership, hospitals can be subdivided into two types: government hospitals, non-government or private hospitals. So government hospital, the hospital is maintained by public funds. Examples are army hospital, railway hospital, government general hospital. Then second type is non-government or private hospitals. These are maintained by private persons or religious bodies. Example, charitable hospital, missionary hospital. Then based on non-clinical basis, we can subdivide into another type, that is based on hospital size. So first type is large sized hospitals. These hospitals are spread over a large area and can consist of 1000 or more beds. Medium sized hospitals. These hospitals are equipped with capacity in between 500 and 1000. Small sized hospitals. These hospitals have bed capacity between 100 and 500. Very small sized hospitals, the bed capacity is less than or equal to 100. So we have seen about the definition of a hospital, the classification of hospitals. So let us see about functions of a hospital. So the basic objective of any hospital is to provide complete patient care, which can be achieved by mutual cooperation and support among the different healthcare professionals. So every healthcare professional should be working together so that they can provide complete patient care. The functions of a hospital are as follows. First function is providing patient care. So to diagnose and treat the illness of the patient and to provide emergency care to the injured. So whenever a patient is coming with road traffic accident, the hospital should provide emergency care to the patient. Then second function is providing public health. to lower the incidence of diseases by early detection, treatment and advice to the public. Then third function is providing education, to provide training and education to the junior doctors, nurses, pharmacists, etc. inside the hospital, and to impart patient education, which is very essential in the management of several diseases like hypertension, diabetes, AIDS, cancer, etc. And to provide education in the area of rehabilitation. So rehabilitation is for alcohol addicts, smoking addicts and drug addicts. So during the rehabilitation services, we have to educate the patient about the withdrawal of the drugs or alcohol or smoking, whatever they are consuming. We have to educate the patient about the importance of withdrawal of the ingredients. Then hospital's fourth function is research, to conduct research in the medical field to develop newer techniques of treatment and improving hospital services. So hospital should be involved in developing new techniques of treatment. Examples of research activities include devising new diagnostic procedures, designing, developing and evaluating new equipment and facilities to improve patient care. Then coming to the organization structure of hospital and medical staff and their functions. So the organization of a hospital depends upon its size. Larger the hospital, larger will be the organization structure of a hospital. In general, maintenance of the hospital lies in the hands of governing body or board of directors. So the board of directors consists of president or CEO, chief executive officer, vice president, secretary and treasurer. In general, the organization of board of directors in all private hospitals is standard, whereas larger the hospital, more will be the administrative positions of the board members and vice versa. So if the hospital is large, the board of directors will be more. If the hospital is small, board of directors will be less. Then what are the functions of CEO? The various duties of Chief Executive Officer of hospital are as follows. He implements the policies and strategic plans of the governing body. So the governing body will be framing some policies and plans, strategic plans to run the hospital. The CEO implements the policies and strategic plans which are framed by the governing body. He acts as a communicator between the governing body and the hospital staff. Under CEO, 1 or 2 persons will be employed who assist him in carrying out the overall responsibilities. They are designated as superintendents. Then he works as per the directions of the board and reports about the operational work of the hospital to it. Then various committees are set up in a hospital for carrying out various functions. They are as mentioned below. The Chief Executive Officer acts as the ex officio member of these committees. The superintendents are assisted by the departmental heads. So the various subcommittees are Executive Committee, Finance Committee, Professional Committee, Public Relations Committee. So what are the various services offered by a hospital? Various important services rendered by a hospital are as follows. First is medical staff services. The medical staff is responsible for the quality of professional services provided by the individuals to the patients. Since medical staff are involved in diagnosis, treatment, prevention of the disease, they are directly involving with the patient. their quality of professional services is very important to the hospital. It is also accountable for its work to the governing body of the hospital. Therefore, medical staff is considered as the backbone of any hospital, and hence it is essential for every hospital to have an organized medical staff. Since the medical staff services are highly important, we have to have an organized medical staff for every hospital. As a general rule, individuals holding license to practice medicine or dentistry are only eligible for medical staff membership. So, individuals having license from the Medical Council of India to practice medicine or dentistry, they can only serve as the medical staff services. All the medical staff members are responsible to provide for the election or appointment of officers and committees. So, to make their work easy, they will be electing or appointing officers and committees. These officers and committees in turn maintain the optimum level of professional services. So, they take care of the professional services. Depending upon the size and activities of the hospital, the framework of medical staff varies. Generally, medical staff is categorized as follows. First one is active medical staff. So, active medical staff is also called attending medical staff. This group is primarily concerned with regular patient care, and it is most actively involved in the patient care activities within the hospital. So, whenever a patient comes to the hospital, active medical staff will be taking care of the diagnosis, treatment of the patient. They are actively involved in the patient care activities. They are also involved in the organizational and administrative duties pertaining to the medical staff. Then comes the associated medical staff. It consists of less experienced physicians who will become a part of the active medical staff in future. So, since they are less experienced, they will not be directly involved in the patient care along with the active medical staff, but in future they will be a part of active medical staff after they gain experience. Then third type is consulting medical staff. It consists of specialist physicians who assist the medical staff as and when required. So, the active medical staff, if they are not able to provide proper diagnosis or proper treatment to a particular patient, if the condition of the patient is too complex, then they will be consulting specialist physicians. They will be going for consulting medical staff, and they will take the assistance of specialist physicians, and they will go for treatment. Then fourth category is resident medical staff. They are full-time trained employees of the hospital who provide specific services in the patient care. So, in a hospital you can find resident medical staff who are available 24/7. They will be providing services 24/7. They are full-time trained employees. Then under the medical staff services, we have seen four types. Under the medical staff services, we have seen four types: active medical staff, associated medical staff, consulting medical staff, and resident medical staff. What are the other services provided by a hospital? So, second type of service is supportive medical services. These services include hospital pharmacy, nursing service, central sterile supply unit, and dietary services. So, coming to hospital pharmacy, it is that unit of a hospital which undertakes the activities of procurement or manufacturing, storage and dispensing of medicines according to the requirements of the hospital. So, procurement is nothing but purchasing medicines, collecting medicines. So, hospital pharmacy is responsible for collecting or purchasing of medicine stock regularly. Also manufacturing of IV preparations. So in previous days, olden days, they used to manufacture drugs in the hospital pharmacy, but right now we have manufacturing units, manufacturing companies. So since they are providing medicines, we will be manufacturing only IV preparations in the hospital pharmacy. It is also responsible for storage. Particular proper storage of drugs is necessary. So some of the drugs require storing in the refrigerator. Some of the drugs require storing in the dry place. So hospital pharmacy is responsible for storage and dispensing of medicines to the patients according to the requirements of the hospital. So hospital pharmacy is under the supervision of a qualified pharmacist who is assisted by several other pharmacists. Its objective is to provide appropriate medicines to the patients at reasonable price. So the price or cost of the medicine should not be a burden on the patient. So hospital pharmacy tries to provide patients with reasonable price of medicine and appropriate medicines. It also instructs the patients about the dosage regimen and usage of drugs. So hospital pharmacy provides instructions to the patients about the dosage regimen, how many days the day drug should be taken, the frequency at which the drug should be taken, whether the drug should be taken in the morning or night or afternoon, how to use the drugs, especially in case of inhalers or ear drops or eye drops. Particular instructions are necessary regarding the usage of drugs. So this will be taken care by the hospital pharmacy. It acts as the drug information center for the medical staff and the public. So the information regarding drug, the mechanism of action, the side effects, drug-drug interactions, every detail about the drug is provided by the hospital pharmacy. So it acts as a drug information center for the hospital staff as well as the public. Then second type of service in supportive medical services is nursing service. This is the largest and important department of any hospital which works for the whole day. It functions under the nursing head. This service includes personal care, health promotion, prevention of diseases and rehabilitation. It also provides prenatal care and comfort to the patient during labor. So before delivery they will be providing care to the mother, and also during the delivery, during labor also they will be providing care to the mother. They also provide personal care and also rehabilitation services for those with addictions like smoking, alcohol or drug addiction. Then trained nurses are employed based on the bed capacity of the hospital. The nursing staff operates in different units of the hospital like central supplies room, delivery room, labor room, operation theatre and recovery room. Then the third type of service under supportive medical services is central sterile supply unit. So if at all a hospital does not maintain a central sterile supply unit, what happens is it leads to spread of infections or communicable diseases. It leads to opportunistic infections in the hospital. So we have to always maintain items in the hospital as sterile. So the department that maintains the items in the hospital as sterile is central sterile supply unit. It is responsible for the supply of sterile items to all the units of nursing, surgery department, clinical laboratory, etc. The items which are sterilized include sterile linen, sterile kits, operation theatre packs, needles, syringes, etc. This unit also provides personnel for the purpose of sterilization in various nursing units. This unit is under the supervision of a qualified pharmacist. Then next service is dietary services. The objective of this unit is to provide appropriate and nutritious food to the patients as well as employees of the hospital. So the services usually are under the guidance of or supervision of a qualified person supported by adequate number of dietitians, technical and clerical staff. They record dietary histories of patients and provide appropriate food for them. Next department is maintenance of medical records. The complete profile of the patient is maintained within the medical records so as to provide a quick reference to the associative and supportive medical staff. So whenever a doubt arises during treatment or after treatment, after discharge of the patient, whenever the associative or supportive medical staff is getting some doubt regarding the patient's profile, they can go back to the medical record department and check the patient's profile. These records are also useful for medical students during their education, training and research programs. Then next services is hospital stores. It includes drug store, surgical store and other items. Since all the drugs cannot be kept in the pharmacy, hospital pharmacy, which dispenses the medicines, they will be allocating separate hospital stores in every hospital. So the hospital stores will be maintaining hospital's drug stock, medicine stock and surgical stock will be maintained by the hospital stores, so that whenever the pharmacy requires medicine supply, they will be sending the drugs or surgical equipment to the hospital pharmacy. Then the next services are other services rendered by the hospital, which are dialysis, social service and hospital library. Then we have discussed about medical staff services, supportive medical services. Then the third type of services offered in a hospital are associated medical services. The associated medical services comprise of anesthesia service, blood bank, clinical laboratory and radiological services. So coming to anesthesia service, the head of the department is a physician who has undergone special training in anesthesia service. This is the main service required during a surgery. So before surgery, anesthesia is given to the patient. So the anesthesia, dose of anesthesia given to the patient is highly important, because increase in the dose or decrease in the dose can lead to side effects, and it can also lead to in severe cases it can also lead to death of the patient. So anesthesia services are highly important. So they have to be maintained by a physician who has undergone special training in anesthesia service. So the person in charge looks into the following matters: administration of anesthesia before and during operation, the chemical agents and equipments used for anesthesia, regarding resuscitation measures and safety regulations of anesthesia. So while giving anesthesia, they have to follow certain safety regulations. So the person in charge will be taking care of that. And resuscitation. Resuscitation means bringing back the patient to conscious state. So when the patient is given anesthesia, they will be going into unconscious state. So we have to bring back the patient to a conscious state. That is nothing but resuscitation. So the next type of service is blood bank. This is an important service which is responsible for collection, processing, storage and supplying of blood of different categories. It identifies the recipient's blood group and performs compatibility test. So before providing a patient with a certain group of blood, the blood bank has to perform compatibility test whether the recipient blood group and the donor's blood group are matching or no. They have to check that. It also provides various blood like dried human plasma, whole human blood, plasma protein fractions, platelet concentrates, etc. So not only blood, other blood like items are also provided. The blood bank should have competent technical staff and one among them should be graduate in medicine. The next service is clinical laboratory. This is an important unit of the hospital which helps in the process of diagnosis of diseases, treatment and their prevention. So a lab report is maintained which helps to decide the type of treatment to be given to the patient. The various samples of blood, urine, sputum, feces, etc. are analyzed for the levels of biochemicals like proteins, sugar, urea, etc. and for pathogens. That is nothing but microorganisms. The tests are performed as per standard procedures. A physician who is qualified in the branch of pathology acts as the head of the clinical laboratory. The next service is radiological services. In this department, radiant energy is used for diagnosis and treatment mainly in the form of X-rays and radionuclides. In modern days, facilities like computer-aided tomography, CT scan, magnetic resonance image, MRI scan, sonography, etc. are also provided by the radiological services. This service is under the supervision of competent radiologist who is assisted by well-trained technicians. So it should be headed by a competent radiologist and he or she should have trained technicians to assist him or her. So this is the organization structure of a hospital. The first comes the governing body or board of directors who frame the policies of the hospital. Under the governing body or board of directors, CEO will be functioning. Under the CEO, he has two superintendents. As I mentioned earlier, under the CEO there will be two superintendents. One of the superintendents is administrative superintendent. So under administrative superintendent, accounts, finance and housekeeping functions are maintained. So the account department, finance department of the hospital are taken care by the administrative superintendent. Then housekeeping functions, maintaining the hospital clean is housekeeping function. So this is maintained by the administrative superintendent. Then under clinical superintendent there are three services: medical staff service, supportive medical services, associated medical services. Under medical staff services there are four types of medical staff: active medical staff, associated medical staff, consulting medical staff, resident medical staff. Under supportive medical services there are different types of services like hospital pharmacy, nursing service, central sterile supply unit, dietary services, medical record department, hospital stores, dialysis, social services, hospital library. Under the associated medical services there are four departments: anesthesia service, radiological service, blood bank and clinical laboratory. So this is the overall organization structure of a hospital. Thank you for listening. please like, share, comment and subscribe to my channel. Press the bell icon for more notifications.